That stiffness when you first get out of bed in the morning, the ache that starts in your lower back and spreads down into your hips and thighs by afternoon, the muscle spasms that come out of nowhere, sometimes so severe they stop you mid-step, the feeling that your back is constantly on the edge of going out. You have probably been told this is arthritis, disc degeneration, the price of getting older. But I want to show you something that permanently changed how I treat back pain in my senior patients. 2 patients, same age, 67, same MRI findings, moderate lumbar disc degeneration, mild facet arthropathy, both told by previous physicians that their back pain was the natural result of aging. That management, not cure, was the only realistic goal. Patient 1 went on anti-inflammatory medication and physical therapy. 6 months later, modest improvement, still in daily pain, still limited in activity. Patient 2, I tested one specific blood marker that most physicians never check in back pain patients. It came back severely deficient. I corrected that deficiency over 12 weeks. 6 months later, back pain reduced by more than 60%. No surgery, no injections, no ongoing medication. Same structural findings on imaging, completely different outcomes, because the muscles of your back, the deep stabilizing muscles that hold your spine in place, that contract and release with every single movement you make, require one specific mineral to function properly, to contract fully, to release completely, to avoid the chronic low-level spasm that is the single biggest contributor to ongoing back pain in seniors over 60. When that mineral is deficient, which it is in an estimated 70% of adults over 60, those muscles cannot fully relax. They stay in a partially contracted state. They fatigue quickly. They go into spasm at the slightest provocation. And the pain they produce is labeled as arthritis, as disc disease, as aging, when the actual cause is a correctable nutritional deficiency that is sitting right there in your blood, waiting to be identified. That mineral is magnesium. And the reason it is almost never identified as a back pain cause is that the standard blood test for magnesium misses 70% of true deficiencies. You can be severely depleted in the muscles and tissues of your back while your blood test reads completely normal. My name is Dr. Michael Kent. I have spent over 20 years in medicine focused on senior health, and today I am going to give you everything. Why magnesium deficiency causes back pain, how to test for it correctly, and exactly how to fix it in a way that works for the aging body. Stay with me, because the second half of this video contains information that most seniors with back pain have never been given by anyone. Before we go any further, if you are not yet subscribed to this channel, please hit that subscribe button and tap the bell icon right now. I post new senior health videos every single week, practical, research-based information that your doctor may never have time to explain in a 10-minute appointment. You do not want to miss what is coming. Subscribe now, then let us get into everything about magnesium and back pain. Let me start with the fundamental question: what exactly is magnesium doing in your back muscles, and why does its absence cause so much pain? Magnesium is the 4th most abundant mineral in the human body. It is involved in over 300 enzymatic reactions, everything from energy production to DNA synthesis to protein formation. But for the purposes of understanding back pain, 3 specific roles are most critical. The first is muscle contraction and relaxation. Every muscle contraction in your body, including in the deep spinal muscles that stabilize your vertebrae, requires both calcium and magnesium. Calcium triggers the contraction. Magnesium triggers the relaxation. This calcium-magnesium balance is essential for normal muscle function. When magnesium is insufficient, the relaxation phase of muscle activity is impaired. Muscles that should fully release after contracting instead remain in a state of partial contraction, a low-level, sustained tension that the brain does not fully register as a voluntary movement, but that the muscles experience as chronic, exhausting effort. Over hours and days, this sustained partial contraction produces the deep, relentless aching that so many seniors describe as their back pain. Not sharp, not stabbing, just a constant, heavy, exhausting ache that is always there. This is also the mechanism behind the sudden severe muscle spasms that are so common in seniors with back pain. A muscle that is already chronically partially contracted, already operating close to its fatigue threshold, can go into full protective spasm in response to a very minor trigger, bending slightly too far, twisting to reach something, standing up too quickly. The muscle that should have been relaxed and ready to respond normally is instead already tense, already fatigued, and tips over the edge into full spasm with almost no provocation. The second role is nerve signal regulation. Magnesium acts as a natural calcium channel blocker at the nerve cell membrane level. It sits in the NMDA receptor, a receptor on nerve cells that responds to pain signals and physically blocks excessive calcium influx that would otherwise cause the nerve to fire pain signals too easily and too intensely. This is called central sensitization, a process where the nervous system becomes over-responsive to pain signals, amplifying them beyond what the actual tissue damage would justify. Magnesium's presence in NMDA receptors is one of the primary natural mechanisms that prevents this sensitization from occurring. When magnesium is deficient, NMDA receptors lose this natural blocking effect. The nerves of the back become hyperresponsive. Signals that should register as mild discomfort are amplified into significant pain. Movements that should be painless become painful, and the back feels fragile, hypersensitive, and unreliable in a way that goes far beyond what the structural findings on imaging would predict. The third role is inflammation regulation. Magnesium deficiency directly promotes inflammatory activity. It increases the production of inflammatory cytokines, particularly substance P, which is a neuropeptide that both amplifies pain signals and promotes tissue inflammation. Substance P is one of the primary contributors to the inflammatory environment around spinal discs, facet joints, and paraspinal muscles that drives chronic back pain. When magnesium is adequate, substance P production is suppressed. When it is deficient, substance P rises, and the inflammatory environment in back tissue intensifies. Now, I want to explain why this deficiency is so extraordinarily common in seniors over 60, because most people assume that if they are eating a reasonably balanced diet, they should be getting enough magnesium, and that assumption is largely wrong for three specific reasons that apply particularly to the senior population. The first reason is reduced dietary intake. The richest food sources of magnesium are dark leafy greens, legumes, nuts and seeds, and whole grains. Multiple large dietary surveys have found that the majority of adults, particularly seniors, fall significantly short of the recommended daily intake of magnesium from food alone. Changing food preferences, reduced appetite, difficulty chewing certain foods, and reduced variety in the diet all contribute to chronically low magnesium intake in older adults. The second reason is impaired absorption. Magnesium absorption from the gut declines with age as stomach acid production decreases. Proton pump inhibitors, the acid reflux medications I discussed in my medications video, dramatically worsen this problem. Studies show that long-term PPI users have significantly lower magnesium levels and that severe hypomagnesemia requiring hospitalization occurs more frequently in PPI users than in the general population. Diuretic medications, commonly prescribed for blood pressure and heart conditions in seniors, cause significant urinary magnesium loss. And diabetes and prediabetes, both extremely common after 60, are associated with increased urinary magnesium excretion through a mechanism related to elevated blood sugar. The third reason is the inadequacy of standard testing. The serum magnesium test, the test your doctor orders when checking magnesium, measures the magnesium circulating in your blood. But only approximately 1% of your body's total magnesium is in the blood. The remaining 99% is inside your cells and tissues, primarily in muscle, bone, and organ tissue. Your body maintains blood magnesium levels within a narrow range through a tightly regulated process that draws on tissue stores when blood levels fall. This means your serum magnesium can remain within the normal reference range even when your muscles and nerves are significantly depleted. The more accurate test is a red blood cell magnesium test, also called intracellular magnesium or erythrocyte magnesium, which measures the magnesium inside red blood cells and provides a much more reliable picture of what is actually available to your muscles and nerves. This test is widely available but almost never ordered routinely. If you ask your doctor specifically for a red blood cell magnesium test rather than the standard serum magnesium, you will get a far more accurate picture of your true magnesium status. Now I want to tell you about a patient of mine named Frank. Frank was 71 years old when he came to see me, and he was, by his own description, at the end of his rope. Frank had been dealing with severe lower back pain for 6 years. He had seen 3 different orthopedic surgeons. He had 2 MRIs. He had been through 2 rounds of physical therapy, a course of epidural steroid injections, and more anti-inflammatory medication than he could count. His most recent surgeon had recommended spinal fusion, the same surgery I discussed in my surgeries video, and Frank had decided to seek one more opinion before agreeing. When I reviewed Frank's records, the first thing I noticed was that in 6 years of treatment by multiple specialists, nobody had ever checked his magnesium. Not his serum magnesium, not his red blood cell magnesium, not his dietary intake, nothing. His MRI showed moderate disc degeneration at L4, L5, and L5S1, which is very common in men his age and present in a significant percentage of men his age who have no back pain at all. His orthopedic findings were real, but not extraordinary. I ordered a red blood cell magnesium test. His result came back at 4.1 milligrams per deciliter, well below the optimal range of 5.5 to 6.5. He was severely depleted at the cellular level. His serum magnesium, by contrast, was 2.1, technically within the normal range, which is exactly why it had been missed. I started Frank on magnesium glycinate, 400 milligrams at bedtime, and recommended dietary changes to support ongoing magnesium intake. I also recommended transdermal magnesium oil applied directly to his lower back muscles twice daily, which bypasses gut absorption entirely and delivers magnesium directly into muscle tissue. At his 6-week follow-up, Frank told me his nighttime back pain had significantly reduced. The muscle spasms that had been waking him up were occurring less frequently. At his 12-week follow-up, he described his overall pain level as reduced by approximately 50%. At 6 months, Frank did not have spinal fusion. He canceled that surgical consultation. He told me it was the first time in 6 years he had felt like he might actually get his life back. Frank still has disc degeneration. That has not changed and will not change. But the pain, the debilitating, life-limiting surgical recommendation-generating pain, was being driven primarily by severe magnesium depletion in the muscles and nerves surrounding that degeneration. Correct the depletion and the pain responds in a way that no surgical procedure could have achieved. Now let me give you the complete practical protocol, exactly what to take, how much, when, and in what form, because the form of magnesium matters enormously, and most people are taking the wrong one. There are many forms of magnesium supplement available: magnesium oxide, magnesium citrate, magnesium glycinate, magnesium malate, magnesium threonate, magnesium chloride. They are not equally effective and they do not all do the same things. Magnesium oxide is the most common and cheapest form found in standard multivitamins. It has very poor bioavailability. Only about 4% is absorbed from the gut. It is largely useless for correcting magnesium deficiency in the muscles and nerves. Magnesium glycinate is the form I recommend first for back pain specifically. It is highly bioavailable, absorbed efficiently from the gut, and the glycine it is bound to has its own muscle-relaxing and sleep-improving properties, which complement the magnesium's effects on back muscle spasm and nighttime pain. The recommended starting dose for back pain in seniors is 300 to 400 milligrams of elemental magnesium as glycinate taken at bedtime. Bedtime is ideal because the muscle-relaxing effect is most beneficial during sleep, when the back muscles are able to fully relax without the demands of upright activity, and because the glycine component promotes deeper sleep, which is when tissue repair occurs. Magnesium malate is the preferred form for daytime use if you want to take a second dose. It is less sedating than glycinate, and the malate component supports energy production in muscle tissue, which helps reduce the fatigue and soreness that comes from chronically tense back muscles. Transdermal magnesium, in the form of magnesium chloride oil or lotion applied directly to the skin over the lower back, bypasses the gut absorption issues entirely. The magnesium is absorbed through the skin and delivered directly to the underlying muscle tissue. This is particularly valuable for seniors with digestive issues or those on medications that impair gut magnesium absorption. Apply to the lower back and hips after a warm shower when the skin pores are open, twice daily. There is one important caution. Magnesium supplementation can cause loose stools or diarrhea if the dose is too high, particularly with forms like magnesium citrate or oxide. Glycinate is the gentlest form for the gut. Start at the lower end of the dosing range and increase gradually over 1 to 2 weeks. If loose stools occur, reduce the dose. For seniors with kidney disease, kidney function is the primary way the body excretes excess magnesium. If your kidney function is impaired, excess magnesium can accumulate to dangerous levels. Please consult your physician before beginning magnesium supplementation if you have any history of kidney disease or if your creatinine or GFR values are abnormal. Let me bring everything together. Chronic back pain after 60 is driven not just by structural degeneration, which is common, often painless and not correctable with nutrition, but by magnesium deficiency that causes 3 specific correctable processes: chronic muscle spasm from impaired relaxation, central sensitization from loss of NMDA receptor blockade, and elevated inflammatory substance P production. 70% of seniors are deficient. The standard serum test misses most of it. The red blood cell magnesium test is the accurate measure, and magnesium glycinate at 300 to 400 milligrams at bedtime, supplemented with transdermal magnesium oil applied to the lower back, is the most effective correction protocol for the muscles and nerves specifically involved in back pain. Frank canceled his spinal fusion, not because surgery is never appropriate, sometimes it is, but because his pain was not primarily a structural problem. It was a nutritional problem that had been missed for 6 years while increasingly aggressive interventions were recommended. Before you agree to any invasive treatment for your back pain, please ask your doctor for a red blood cell magnesium test. It is a simple blood test. It costs almost nothing, and it may reveal a correctable cause of your pain that has been sitting there unidentified for years. If this video gave you something genuinely valuable today, please do 3 things right now. First, give this video a thumbs up. It helps this information reach more seniors who deserve to know it. Second, leave a comment below. Did you recognize your own back pain in what I described today? Have you ever had your magnesium properly tested? I personally read every single comment and reply to as many as I can. And third, share this video with someone you know who is living with chronic back pain and has been told it is just aging. You may be giving them the piece of information that changes everything. Subscribe to this channel for weekly senior health videos that are honest, research-based, and always practical. I am Dr. Michael Kent. Thank you for watching. Your back has been trying to tell you something. Now you know what to do about it. I will see you in the next one.